welcome back. Today marks the first day of Suicide Prevention Awareness Week. Here to talk about it, I'm joined by Dr. Sreela Roy, who is presently the clinical manager with AptaHealth. She's also a licensed mental health counselor who has worked in behavioral health and addiction for 17 years in the Capital Region and across several agencies. Dr. Roy, thank you so much for joining me to talk about this really important issue.
Thank you for having me.
So one of the first things that I wanted to talk to you about is the fact that mental health and suicide prevention awareness go hand in hand, because we know that certain mental health issues people face can often lead them to have certain suicidal ideations.
Absolutely.
Could you talk a little bit about that?
Absolutely. So some of the primary mental health diagnoses that people seem to struggle the most with are depression, bipolar disorder, or what was previously known as manic depression, anxiety disorders, substance use disorders, and one of the more unspoken ones, post-traumatic stress disorders. Those are all the primary diagnoses that seem to be mostly associated with higher suicidal thinking or more increased suicidal ideation.
Okay. And if a person is experiencing one of those or multiple of those mental health diagnoses, they start to have suicidal thoughts, what should be their first course of action?
If somebody's starting to think about those suicidal thoughts, the immediate first step should be to ask for help. Now, whether that's with a loved one or if they feel too scared or too frightened to even begin those conversations with somebody that they know or trust, they can always ask for help, calling the suicide prevention hotlines, asking for help, looking for resources in their community to be able to say, I need help, I need to see someone, I need to speak about this. The sooner a person actually gets the help, they get the intervention, the better it is for them to be able to get what they need, have it in place, and feel safe, ultimately preventing any chance of them taking action.
And with treatment and with help, people can come out of this. We want them to know there is hope.
Yes, absolutely, there is hope. You know, the saddest part is that the majority of the people we've lost to suicide had a diagnosable mental illness. And mental illness is treatable, and that's the hard part. There's such a stigma now around having any sort of, and there always has been a stigma around having a mental illness, even something like depression or having anxiety. People are scared to talk about it. They're afraid of being judged. They're afraid of, oh my God, are they going to send me to the hospital? Are they going to send me to the loony bin? You know, a lot of the things that we see in media have unfortunately influenced people into thinking that having a mental illness is something to be afraid of, something that can't be fixed, something that can't be worked on. It is an illness. It can be treated. And I think that's the first thing, that's the most important thing that people need to understand, is that there is help, there is hope.
And that's what we're hoping to let people know about through this interview, let them know that help is available.
Absolutely.
And that mental health and suicide are not taboo topics to discuss.
Absolutely.
So thank you so much for joining me. And we have more details on our website, news10.com, as well as specific resources and more about that suicide hotline. You can also see it on your screen right now. That's 988. That was just put into place in July, but the old number still works as well. You can also go to afsp.org. There are lots of resources and literature there about Suicide Prevention Awareness Week. Thank you so much, Dr. Roy.
Thank you for having me.
All right, we'll be right back after a short break.